We know that this talk this year in TIBCS is about the adjuvant radiotherapy after neoadjuvant treatment. Do you think it's okay to adjust radiotherapy based on the response to neoadjuvant systemic therapy, or even based on the molecular subtypes, and to modify the radiotherapy dose or the radiotherapy volume?
I think that certainly is the goal of a number of clinical trials. I think at this point in time, I think what is clear is that there is a paucity of high-level evidence to guide these sort of decisions in radiotherapy in terms of modifying or customizing the indications for radiotherapy or the target volume for radiotherapy according to the response to neoadjuvant systemic therapies. I think our audience may well be conversant with the number of clinical trials that are ongoing right now, including the NRG studies, the Alliance study, and the IBCSG trials, all examining whether the response to a neoadjuvant systemic therapy could serve as the basis to guide this sort of information about radiotherapy. I think at this point in time, and I would expand a little bit more in my presentation at your conference, there isn't that sort of high-level data. However, if we look at the non-prospective trials in terms of the review of the retrospective studies, I think there is